Hi students, welcome to this video of oral pathology. I'm Dr. Kopi Krishnan discussing oral pathology with you. In this video, we will be discussing soft tissue lesions. Soft tissue lesions, first in this video, we will discuss benign soft tissue lesions. Okay, so there are certain soft tissue lesions they can ask you in your INACT exam. So I will give you a brief idea about how many types of soft tissue lesions are there and what to study in this. Okay, so there is no need to worry about soft tissue lesions. Soft tissue is a very big vast chapter. Okay, but do we want to learn all these things? No. See, they always ask you the basic concepts, basic things in soft tissue, because diagnosis of soft tissue is always based on its immunohistochemical markers. Okay, so diagnosis of soft tissue is not that easy. So they will never ask you any histology based question in soft tissue. They will not show you any HNE picture of soft tissue and tell you to diagnose, because all the soft tissue lesions mostly they are all spindle in shape. Okay, you see any of the soft tissue, either be a fibroma, either be a schwannoma. Okay, most of them are presented as a spindle cell lesion. Now, how to identify these is certain small histological features as well as immunohistochemistry, IHC. So you can expect that they may ask you one word or factual questions in soft tissue, but not any image based question. Okay, so let's come to the soft tissue lesions. Soft tissue tumors. Okay, soft tissue tumors, they are both benign and malignant, right? Benign and malignant. Okay, and out of this we will discuss benign down. Okay, that soft tissue, what you mean by soft tissue? Soft tissue is by soft tissue we mean the connective tissue, right? So in the connective tissue there are so many cells, so many type of cells. Okay, and tumor can occur in any of these cells. That is, first one is fibroblast. Fibroblast, what is the function of fibroblast? It makes collagen fibers. It is a main connective tissue, right? So the benign tumor is called a fibroma. Okay, fibroma, while the malignant tumor is called a fibrosarcoma. Okay, just add the term sarcoma. So epithelial cancers, epithelial tumors are carcinomas, and connective tissue tumors are sarcomas. Right? The connective tissue malignancy is sarcoma. Epithelial malignancies are carcinomas. So second one, fibroma. Then you have your nerves. If you take the nerve, okay, what happened in the nerve? There is schwannoma. Okay, schwannoma, the benign tumor of your Schwann cells. Okay, I'm writing benign here, I'm writing malignant here. Schwann cells, that is schwannoma. And there is a tumor called neurofibroma. Neurofibroma, that is the perineural fibers, the fibroblast, they get a tumor. And the malignant tumor is MPNST, malignant peripheral nerve sheath tumor. Okay, and here comes the third one, that is your fat cells, or we say adipocyte. Adipocyte, the lipoma, and the malignancy is liposarcoma. Okay, liposarcoma. And skeletal muscles. What about skeletal muscle? Rhabdomyoma and rhabdomyosarcoma. Okay, rhabdomyosarcoma. Okay, that is one thing. And if you see the smooth muscles, what about the smooth muscle? Smooth muscle is leiomyoma. Leiomyoma and leiomyosarcoma. Okay, that is one thing. Now these are certain examples of your soft tissue tumors. Now let's see in this video, let's see what are the things you should learn in a basics, learn the basics in a soft tissue tumors, just like a fibroma, what they can ask you from a fibroma. So fibroma is originating from the fibroblast. You know that it's a fibroblast, but you should know certain facts about fibroma. It is the most common benign neoplasm of your oral cavity. If they ask you which is the most common benign neoplasm of oral cavity, the most common benign neoplasm of oral cavity is your fibroma, and most common site of occurrence is your buccal mucosa. Okay, buccal mucosa is the most common site, and it may starts with a small trauma. So the reason can be a small trauma which will stimulate this fibroblast, and there is a production of this fibroma. And how it appear? It will appear as a small swelling. Okay, it will appear as a swelling, and this swelling will be sometimes pedunculated or fixed to the buccal mucosa. That doesn't matter. Okay, so please remember, it is the most common benign neoplasm. It's originating from the fibroblast, and most common site is your buccal mucosa. Now there is another fibroma that is called a giant cell fibroma. Giant cell fibroma. The only difference in this giant cell fibroma is that you see particular type of giant cell in this. Along with fibroma, you see some giant cell, and giant cells are star shaped. Those giant cells are star shaped or triangle shape. That is called a stellate giant cells. Okay, you see stellate means they are star in shape. Okay, that is one thing, giant cell fibroma. Now there is one another benign tumor. So we have seen two benign tumors. One more benign tumor, that is called a fibrous histiocytoma. Fibrous histiocytoma. Now what is the peculiarity of this fibrous histiocytoma? From the name itself, there is fibrous and histiocyte, fibroblast and histiocyte. So it's a tumor of two cells actually, fibroblast and histiocyte. Now what's there in fibroblast and histiocyte? What is histiocyte? Histiocytes are tissues defense cells, right? Your macrophages, when they come to tissues, they differentiate to form histiocytes. So they are tissue macrophages actually. They are defense cells. So fibroblast will make the it will make the connective tissue, and histiocytes are the macrophages, okay, differentiated macrophages. So these both are having tumor here. That is a tumor of two cells here. They are called a fibrous histiocytoma. Now what to learn in this is that there's a particular appearance, the histological appearance of this fibrous histiocytoma is that it will appear in a storiform pattern. Storiform pattern. What you mean by storiform pattern? You have seen this straw mat, right? Straw mat, mat which is made of straw, right? This is seen in made of grass, the straw mat made of grass. Okay, so this appearance, the fibers will be arranged in such a fashion that it is like in a straw mat pattern or storiform pattern. Okay, this pattern is seen in fibrous histiocytoma. So they may ask you this question in your NEET examination. Okay, they may ask these patterns. Okay, please remember the patterns in soft tissue tumors. Storiform pattern is seen in fibrous histiocytoma. Okay, now next one, there is another tumor that is called a solitary fibrous tumor. Okay, solitary fibrous tumor. Now this is very important. This is a very important tumor they have asked in your previous NEET and INACT examination. Solitary fibrous tumor is actually a new name. Old name is your hemangiopericytoma. Okay, hemangiopericytoma. So hemangiopericytoma is the old name, and solitary fibrous tumor, SFT, is a new name. So actually this is a new term. That's why they are very interested in asking this. Okay, the NEET and INACT people, they always ask the recent things. Okay, they are checking that if you are aware about the recent thing. This you may not find in the textbooks. Okay, so that is hemangiopericytoma. That name was replaced by solitary fibrous tumor. Now what is the feature of this hemangiopericytomas? Are these hemangiopericytomas, blood vessels. In normal condition, blood vessels are just round structures, but in certain tumors, this blood vessel will have branches like this. Okay, so blood vessel will have branches. Blood vessel will be branching. Okay, plus blood vessels show branching. Blood vessels will show branching, and that branching is looking like a stag horn. You may have seen stag. Stag is a animal, just like a deer. You have seen the reindeer, its horn like this, right? Imagine this is a stag. Okay, imagine this is an animal, stag. Okay, smiling faces. And see the horn. Okay, stag horn pattern of blood vessel, that is seen in hemangiopericytoma. Okay, but that hemangiopericytoma is now replaced by solitary fibrous tumor. That term is replaced by solitary fibrous tumor, SFT. Okay, so this is one thing. And the question they have asked in NEET was, which is the intraoral site? Intraoral site where you see solitary fibrous tumor. Again, it is most commonly seen in your buccal mucosa. Buccal mucosa. Buccal mucosa is the most common site for your solitary fibrous tumor. Okay, so this is one very important thing, SFT. They may have many questions. And next one, if I see, I would like to discuss lipoma. Lipoma is very easy. Lipoma is a benign tumor of your adipose tissue. One thing you should know, where is this lipoma most commonly seen? You know, most commonly lipoma is seen in the what extremities on your body. So it is the most common tumor of your body, most common soft tissue tumor in human body. If they ask you, that is lipoma. Okay, but most common soft tissue tumor in the oral cavity is your fibroma. Okay, most common soft tissue tumor in the oral cavity, fibroma. Most common soft tissue tumor in the human body, that is lipoma. And what is the most common intraoral site? Means if lipoma comes in the oral cavity, what is the most common site where it can come? Is buccal mucosa. Okay, buccal mucosa. So this is certain things, certain facts you should remember in your soft tissue lesions. Okay, now there is one another lesion here that is called your neurofibroma. Okay, I will neurofibromas and schwannomas. Let's see what is there in a neurofibroma. Neurofibroma and schwannoma. That is your benign tumor of your nerves actually. Okay, benign tumor of your nerves is neurofibromas and schwannomas. Now, what is there in neurofibromas and schwannomas? You know, in neurofibroma or schwannoma, neurofibroma, it is mainly caused to the perineural fibroblast. Perineural fibroblast is the one which is causing this neurofibromas. But schwannomas are arising from this Schwann cells. Schwann cells. Now, how the appearance of this schwannoma is, that this is very important. The histological appearance of schwannoma is very important. Now, in schwannoma, what you are seeing, that you see two areas in the same tumor. In the same tumor, you can see two areas. One area will have more number of cells and one area will have less number of cells. Okay, so in areas where there is more number of cells, we call it hypercellular area. Where there is less number of cell, we call it hypocellular area. Okay, hypocellular area. The histology of schwannoma is very important. In the schwannoma, there is two histological areas. That is, one is hypercellular, one is hypocellular. Hypercellular area is called Antony A area, and hypocellular area is called Antony B areas. And in Antony A area, we can see a thing that all the cells, most of the cells are arranged in a palisaded pattern. Okay, the nucleus will be arranged in a palisaded pattern. The cell will be arranged in a line like this. All the nucleus will be arranged in a line. And this type of arrangement is called a Verrocchio body. Verrocchio body is seen in Antony A area. I will show you the image here, then it will be very clear to you. Okay, this is what we are seeing here. Can you see this picture? Now, this is an image, IBQ. This is an image based question because schwannoma's histology is very interesting. That's why it is an IBQ. Okay, so in schwannoma, you can see that there is two areas. If I draw a line here, I have these areas which is less in number, less in cells. Okay, I will just magnify it. So you can see that in this area, in this much area, you can see so much of cells, so much of nucleus. This is hypercellular area. Hypercellular area or Antony A. This area is less number of cells, hypocellular. Okay, this is hypo. So this is called Antony B area. Okay, now if you take the Antony A area and magnify it, you can see that, see these cells are arranged, the nucleus are arranged towards one side and the cytoplasm towards other side. So you can see this appearance. Can you see that appearance? The cytoplasm is here and the nucleus is towards both corners, right? The corners, or it is in the same straight line. This is called Verrocchio body. Verrocchio bodies. Okay, so Verrocchio bodies are seen in your Antony A areas. Okay, so they have asked a question where okay bodies are seen in Antony A, Antony B, both Antony A and B. Okay, where okay bodies are seen where cells are more. Okay, that is your Antony A area. So this is a picture of your schwannom. Okay, and nothing much they will ask about your leiomyomas or rhabdomyomas. No other benign tumors are being much asked. So this is a basic idea about your benign soft tissue tumors. Okay, so I hope you understood the basic idea of benign soft tissue tumors. See you in the next video with the new topic.